All right, let's get rolling here. I've kind of 5 minutes past the start time. I wanted to get a few individuals to get into the door, but thank you, welcome everybody for the this last session. Really focusing in on a pretty heavy topic in construction, and one that I think is extremely important. And we're going to kind of go through a number of things. How many people sat through the breakout group last year that Brandon did on mental health? A few. So you'll probably see some similar things that Brandon and I do, a number of these around the country in a given year. So let me do a quick introduction. My name is Scott Staffon. I'm with Holmes Murphy Construction. We're an insurance broker specializing in the construction and engineering industry, and that's what I've done my entire life is construction. I'm on 44 years in construction, so I've done a little bit of everything, from being a laborer, carpenter, project manager, to an executive. And then about 15, 18 years ago, I got into this insurance broker world. So that's where I've been ever since. We've had a focus on mental health within our company since 2017, pre-COVID. I know a lot of people, this focus has started around the 2019 timeframe when COVID came into play, but we recognized that in the construction world, for some reason, we can't reduce the fatality rate in construction from what it's been. It's been around 1,100 to 1,300 construction workers every year lose their life on a construction site. Probably 5 times that as many in an automobile accident driving for construction-related business. So, you know, we see somewhere around 6,000 to 8,000 individuals in construction lose their lives, whether it's on the job site or driving or in some kind of automobile-related issue. And I fully believe that mental well-being, mental health has been a big impact and a big driver of that. So we wanted to start focusing on some things other than just safety programs and policies to try making a difference. So as we get going here, if you have a question, please raise your hand. Marcus here is going to help me here. He has a couple of these really soft, cool mics and speakers that if you have a question, he's going to toss it to you so you can ask it into the little box so everyone can hear the question if you have one. All right. I always start off with this slide because a lot of the stuff I'm going to cover is going to be pretty heavy. It's going to be pretty deep. And if you are triggered, have some emotions, you start getting a little anxiety because some of the things I'm talking about might be hitting pretty close to home, it's all right to get up and go out in the hallway and take a minute to yourself. But I don't want anyone to be caught off guard when I start hitting on specific topics or specific things. The one thing you're going to see in here in a second here, I do ask, most people when they're presenting want you to put your cell phone away. I want everyone to take their cell phone out because you're going to be part of this presentation here in a second. And I'm going to ask some very, very personal questions. The questions are all anonymous. I don't record them. The reason I do that is I don't want people in here to think that they're the only one that might be struggling with an issue. Because right now I can tell you in this room there's about 60% of us that have some type of mental well-being issue that you're either struggling with or dealing with right now. That's just a fact. It's not just this audience. It's a fact that any audience I go to in the country and do this, it's about 60%. So we're not alone in this, which I think is the stigma. We always think it's our issue and nobody else is suffering or struggling or has the same feelings or things I'm going through. So we're going to walk through some of that. Okay, so take out your cell phones. You don't have to do this if you don't want, but I encourage you to do. Scan that QR code. It'll take you into a landing page, and at the top of the landing page, you're going to see something that says QA and something that says polling. Please click on the poll side of it, which is on the right-hand side. Now, there won't be anything on your screen. It'll just be blank. It'll just say polls because it'll wait for the question to come up. If the QR code isn't doing, you can go to the slido.com and just enter that code right there, which is 1457641, and just hit the enter button and you'll be good. Any challenges? Everyone good? Okay. And when the question comes up, you'll see it pop up on your screen. So right now there's nothing in there. It'll be when the question hits when it comes up on the screen, you'll see it on your phone. Okay, so let's talk a little bit about this topic, mental health. 50% of the people in the U.S. have some diagnosable condition related to mental health. And I think the word mental health in general is the one that scares people, because mental health has a wide range of what it covers. From simple stressors such as anxiety, maybe some simple stress, other things that come along with it, maybe some up and down feelings and stuff like that. Those are all categorized as mental health. And then we get over on the other spectrum into some treatable diagnoses where you have to go actually see somebody or get some help. So it's a wide range. So I don't want this word mental health to be scary. I use mental well-being because I think it's a softer word that's maybe not as scary but still means the same thing. I think the problem in construction, and we're going to get into it a little bit deeper in a few slides, the stigma around construction being this industry of tough individuals, the type of industry that it is. I think there's a lot of stigma that goes with people feeling or thinking they can't bring things forward or discuss these things or even suggest that they have some type of mental health related issue or some kind of mental well-being thing that they need to get some help with. So we're going to walk through some of those things, kind of go through my statistics, and then we're going to answer some of these questions. So here's the first one. This is the one I always start off with. And again, this will be a word fill. So what words do you think of when you hear the words mental health or suicide? Again, type in the words. They come up on the screen. You can type as many words as you want. They come up on the screen. And as a word gets bigger, that means more people have typed that word or similar in, and it's the one that a majority of us are taking a look at. So right now you can see depression, stress, sad. You see death, you see anxiety up there, depressed. All the words that I typically would see from most people that answer this question. And I always start off with this question because it's interesting just to see where people are at in what they say, and understand that this is what the workforce out in the construction-related industry is thinking as well, too. When I do this for workers, and I mean at the worker level, the words are very similar in nature. So it's not just where we deal with we what I'll call the executive or the administrative level, where we may be different than the trade worker. I will tell you we're not. So when we think of this, I always tell people, just because somebody's a laborer and getting dirty in the field doesn't mean that they think any differently than what people in this room do, or people in this room think differently than they do, because they don't. Everyone deals with the same issues and challenges in life. It doesn't matter what you do for a living or what you do from a work status standpoint. That's the fact. All right, so I'm going to give you a couple of messages as we get through this thing. The word mental health shouldn't be scary, and you've heard me say that a couple times. You'll hear me say that about a dozen more times today as I go through this. Those two words should not be scary to anybody in here. Matter of fact, the more we can break down the fact that that word is not scary, the more people are going to come forward and have discussions related to that and seek help and get resources to that. It's real. And I will tell you that in the construction-related industry, regardless of what we do, it is real. And you're going to see the statistics. It's 5 times what it is in the general public and what our construction workers are dealing with and what they're facing today and the type of work that they're doing. Just because you can't see it doesn't mean it doesn't exist. I think that's the bigger challenge with this related issue, is that it's easy for a safety professional, somebody to go on a job site and talk about safety and write policies and different things and talk about that. But you don't see it on anybody. You might be able to make some observable things about an individual based on how they're changing because of what's impacting them, but looking at somebody, you're not going to know. They look like me. That's what they look like. So just because you can't see it doesn't mean it exists. I think that's the biggest barrier I've had to knock down the last 3 years is from executive level people that own companies and that run companies, they just like, well, I don't see it out there. I'm like, exactly, thank you for saying that, because you're not. And the last two pieces will wrap up in how we bring this thing to the end, which is we need to be, everyone in this room, every company that I deal with, every executive, every leader, they need to be a leader, not a follower. And what I mean by that is, are they out in front? Are you out in front making a difference, talking about this and making it normalized within your company? That is a topic and a subject that people can come forward with and seek help and seek resources. And the last one is, it's just have courage and be bold. It's a very hard topic to talk about. It's also very hard to approach somebody that you might think is struggling or needs help. The first time you do it, it will be one of the most terrifying events in your entire life when you're trying to figure out how to approach someone that you may think is in need of help or is struggling with something, but I will tell you that they're looking for you to do that. When my son passed away 6 years ago now from an overdose, no one wanted to talk to me for about a week. They avoided me like the plague. Until one person had the courage to ask me how I was doing. I don't know if that saved my life or not, but it was a huge factor in my life. But I can tell you that first little bit, people were just like, they didn't know what to do until somebody said, hey, how you doing? And I said, not worth a crap. So, all right, so let's talk about the impact. So when we look at suicide rates in the U.S., if you look at what I have here, I have a whole bunch of information on this, but the national average for suicide rate, and this is per 100,000 individuals, it's around 17 per 100,000 from the general population in the U.S. that is struggling or has died by suicide. Now, I will tell you that number, if you start breaking it apart, and I was just talking to an individual here prior to this starting, we're starting to see this number creep up, unfortunately, and we're specifically starting to see creep up in the mid-teens to the mid-20s. Unfortunately, that number and that rate starting to creep up probably at the most rapid rate of any one of the demographics that we see out there from an age standpoint, but it is a number that we really need to focus in on. If you take a look at that right-hand number up on your screen there, the 10.1, that is what we see from an average of job site fatalities on a given year. And that number, I say, has stayed pretty consistent, somewhere between 1,000 and 1,200, 1,300 on a given basis on every year. That number hasn't changed for years. Then we take a look at that middle column. That is the suicide rate in the construction industry. 53 per 100,000 construction workers are losing their life to suicide. 5 times the average of what we see die on a construction-related accident on a job site. We've got these cool terms that say, you know, why do we want to do safety? We want to get the person home at night. Mental well-being and mental health is about how do I get the person from home back to the job site safely every day. So we have to have a focus on both when we start talking about safety. We have to have a mental health component to that, and then we have to have some job site requirements and things on that order. But when you take a look at this, we got 5 times the related potential for a construction worker to lose their life to suicide versus a job site related fatality. And then as we start breaking the trades down, which is obvious when we start looking at these things, but obviously iron workers are the highest, 79 per 100,000. I think it's easy to understand why iron workers wouldn't be that high because of the high stress, the type of work that they do, heights, all kinds of related hazards, crazy stuff that they do, very stressful, lots of pressure, lots of things on them. Millwrights, masons, you take a look at these individuals, those top 4 have a lot of high risk, a lot of high hazard related things that they are exposed to on a daily basis. So the pressures, the things that they feel, is obviously part of the reason why that number is so high. The interesting piece that we're starting to see and focus a little bit more on, it's the 4th from the top down, but construction managers, I think we're trying to get a little bit better handle on it, and I think we need to get a better handle on related management positions that are struggling with this, because obviously if you think about construction managers and anyone running construction sites, think about the pressure that they're under, right? Related to job performance, financial, scheduling, all of those things that come with that, and that amount that they deal with on a day-to-day basis, and how that contributes over time to someone's mental well-being. So we're going to kind of get into that, but I think this is I just wanted to bring this up really quick just to kind of show you where, somebody falls, and it doesn't matter who you are. You see laborers there. People think that's the simplest common denominator for an individual on a construction site, so labor, right? But then you got operators, electricians, plumbers. I mean, they're all in there. Every trade is way above the national average. Probably the scary part about this is that for every one of our construction workers that die by suicide, and you'll hear me repeatedly say die by suicide because there's no such thing as committed suicide. It's you died by suicide. Okay? Words matter. How you present this matters. I didn't commit cancer. I didn't commit heart disease. I didn't commit any of those things. I died by heart disease. I died by a heart attack. I died by cancer. It's died by suicide. So words do matter. You'll hear me say that repeatedly here throughout this. The interesting thing about the statistics of over 5,000 construction workers losing their life is just how many attempts at suicide there are. And based on the numbers we know, and this is from the Veterans Association and looking at some of the other associations, AFSP and NAMI out there, for every one individual that dies by suicide, there is another 29 attempts at suicide of individuals that were unsuccessful, or whatever term you want to use there. What's that equate to in construction? Another 160,000 workers are impacted on an annual basis from trying suicide to take their life. It's a pretty large number, isn't it? This is a crisis in construction. Now, the individual I was talking to, we're trying to get our head and hands wrapped around the situation in construction. I will still tell you that the Veterans Association is still trying to get their hands wrapped around the veterans' rate of death by suicide. We're still seeing 19 individuals die on a weekly basis from suicide in the veterans, and you would think by now we'd have that figured out. So this is a long ways to go. There's a lot of things you can do. We're going to just briefly touch on some of these things, but there's a lot of stuff we can do. Okay, next question that'll come up. Indicate, and again, this one is, you can select any one that you want. Select it all that apply. Indicate if you've been personally impacted by suicide. So you can identify one, none, or all of them. I think this one allows you to pick multiple ones. And the reason I ask questions like this, and again, it brings what I'm doing, not just a bunch of words and me sitting up here talking with some statistics, some different things like that. I think it brings into the fact of you can see the impact that suicide has had on everybody's life in here. You don't see zero on any one of these categories that I asked you to pick or select. Matter of fact, we're close to 60% on neighbors and acquaintances. Extended family. Take a look at these percentages. They're pretty high and pretty significant. I guess I should ask the one to say no impact, because I'm going to guess that still might stay 0. Might be a couple in here that haven't had an impact on it, but I can pick every single one of those for my personal life. Every single one. So just understand that as we talk in here, everyone has had an impact related to a suicide from a personal perspective. Depending on where that falls in there, close friend, extended family, coworker. I mean, we're talking 25% of us in here that have had an impact from a suicide from a coworker. I've done this out in the field with construction workers, and that number's been as high as 45%. Out in the field. All right, so let's define it. And again, I talked about this earlier. Mental health has a wide range. It's a diverse definition of what this means. Again, simple stressors, and I'm going to talk about stressors because I think that's where we need to take this conversation. It's not conditions, it's not diseases, it is what stressors impact your mental well-being, right? Simple things as stress, anxiety, right? Fatigue, varying moods. Those are all technically a definition that would fall within the mental health bucket. And we may not think that or recognize that, because if I said mental health to everyone you walked in here, you probably had a lot different thought process and definition behind that, such as hospitals and psychiatrists. And in the 1950s and 60s and 70s, what did mental health mean in the movies? Asylums, straitjackets, right? All those things, that's what it referenced. And I still think people have this bigger thought process that's what it is. If I say mental health, everyone's going to look differently at me, and I still think that's the stigma. If I say that I have a mental health condition, people won't come out and talk to me unless they know I don't have it, so I'm not going to say anything because they're going to think differently. And that's the challenge we're still in today. Is people think if I bring this forward, they're going to look at me differently and perceive me differently and maybe not interact with me. Okay? So those are the things we got to break down. So non-clinical challenges, burnout, grief, mood changes. There's obviously, as we get more deeper into this, there's the diagnosable conditions, PTS, OCD. There's a lot of other ones, bipolar, things in that order. But also, too, remember, mental health has a definition about positive experiences and positivity in your life. That's all part of mental health, too. The definition that people think of mental health in here is all negative, and it can only be bad, but that's untrue. Mental well-being is both good and bad. We have to figure out how to bring more good into it, and then how do we get resources and help for some of that bad that's in there to help us bring it back to the good side. So we're going to get into that. The other thing to understand about mental health, mental well-being, stressors, is that everybody in here, and a couple of people were asking me, is there templates for this? Is there kind of things that we can do? And the answer is there's not really a standard thing. There's things we can do, but there's not one thing. And the reason I say that is that everybody in this room will have a different reaction, a different way something personally impacts you. And that's what you see on the scale here, from a low impact to a high impact. What might be something that's a low impact to me from a mental health stressor or mental well-being stressor, somebody in the audience, it might be 180 degree. It might be a high impact on your mental well-being. So we can't take this thing and put it into a box to say everybody is exactly the same in how they react and what they do and what their response is going to be, because that's untrue. So what we can't get into is if you're going to approach somebody on this topic because you think that they need to have somebody ask them how they're doing, you can't try to help them by thinking about how you would react to it. you can't help them treat it, because if you think that it's a low impact to you and that's how you're trying to encourage them, it's probably putting them in a further spiral because they don't think you get it. What we're looking for is simply, how are you doing and what can I do to help you? That's all they're looking for. But don't take this and think that because you would have a low impact to it, you can't figure out why they would have an impact, so you're trying to convince them not to have a high impact, because that'll make things worse. That's really what the intent of what I wanted to show here is. You just have to say, how can I help you? All right, here's the next question. Have you experienced a major stressor or traumatic life event that has impacted your mental well-being or health? I'm kind of watching the answers up there. You'll see in the upper right-hand corner how many people are answering the question for me. So I'm kind of seeing 90% of us. So why is it taking, and I always ask this question, and it's kind of a rhetorical question, I guess. Why is it taking us so long in the construction industry to figure this out? This number just didn't start today, didn't start yesterday, didn't start 2 years ago, 3 years ago, 5 years ago. It's been going on for a long time. We've got people that have impacts on their life all of the time. This isn't something to take some dirt, rub it on the wound, and get back to work. Or put a Band-Aid on it, you'll be fine. Or put some ice on it, and you'll be good to go tomorrow. That's not how this works. So again, where's my barriers to this? And again, if you got questions, please shout them out. I'm going to go through a lot of stuff pretty quick on a high level, and we could spend 3-4 hours here. But so where is our barriers? It's pretty simple, right? So 83% of our construction workers, we've seen that number in here. It was 90% in this room where somebody had something that has impacted their mental well-being. We were at 90%. Construction, conservatively around 83%, maybe a little bit more, of our workers are struggling with something that they're dealing with that's impacting what they're going through on a daily basis. Lack of recognition, minimize and rationalize, right? Fears and shame. I will tell you, fears and shame should be the number one thing on that list, really. They're afraid to bring it forward because they're fearful that everyone in this room would judge somebody if they raised their hand and said, I have a mental health issue that I need to have help with. Fear of judgment by peers, feeling inadequate, lack of trust. We're going to talk about that last one here in a minute. When I get to it, access to resources. That's our challenge today. Big time. The thing at the bottom of the screen is probably the most important piece that we got to start breaking this cycle on. Right now, at the best from from what we see from the studies and all the polling and stuff, from the time an individual has some kind of onset of stressor that's impacting their mental well-being and their mental health, there's a delay of 11 years before they get some help for that. I don't know why our numbers are so high. Death by suicide? Right there. 11 years. Think about if that number's cut in half today, what does it mean for our numbers? Think about if we cut that to a year. Think if we cut that to months, weeks, days. What does that mean to our industry? If they have access to resources, access to get help, places they can go to seek and figure out things. Make a huge difference. But that's our barriers right there. This is in every one of our companies. Doesn't matter who you are, or what you do, what your company does. Just understand how you answer these questions. Everyone that's in your company will answer them exactly the same way. And that's a fact. Here's what happens on this scale here. Remember, I just showed you it's from the time I have some kind of stress or some type of emotional impact that is really taking a toll on my mental well-being. over 11-year window until I seek some help or get some help or something worse even happens. We start on that lower left side of that scale, and that's our low impact, that's our low risk. That's where something's starting to happen to us, maybe some basic stressors, some anxieties. Something's happening at home, something is happening at work, my kid's doing something, spouse and I are not getting along right now. Maybe there's something going on at work or there's something going on in a project, and we start on that left-hand side. The longer I go without seeking or getting help or having the resources, start having some understanding of what's happening to me or the impact to me or where can I go or what can I do, I start gradually moving from left to right on that scale. The symptoms start to get a little bit more impactful. They start having more of an impact on my mental well-being. I start seeing more stress, more anxiety. All of a sudden, I've got a loss of focus, and we're going to talk a lot about that coming up. We're going to talk about that word right in the middle here in a few slides called presenteeism. So if you haven't heard of it, it's a real word, but if you haven't heard of it, we'll talk about it in a second. Pretty soon, you're over on that right side of that scale, which is lack of engagement. Pretty soon, it's tardiness. Maybe it's not showing up to work, maybe it's more sick days. Pretty soon I'm fatigued, all of a sudden I've got a lot of other things going on. And then we start seeing the substance misuse, maybe more heavy drinking, maybe we decide to do other things and different stuff like that. So you're gonna have a question. So Marcus, I need you to feel free to throw it, it's soft.
I don't want negative evaluation. I was curious how this chart relates to your earlier slide about 11 years from stressor to, accessing resources and how long you might be in green versus yellow versus orange versus red. And I recognize it's not the same for everyone, but do we have any data or understanding about that?
I don't know if we have exact data on it or how long it takes to get there, but I can tell you that the longer it goes, like if I have something today and I'm still struggling it, like I think back to when my son died. Had that individual not reached out and I sat there for more time, I don't know how quickly I would have got to the right-hand side of the chart, but I would have been there. Somebody could get there extremely quick. Right. And then somebody might have these things where it's just slowly building up because maybe over time it's one of their children they're having struggles, or it's a financial thing at home and they're trying to figure out how to continue to make ends meet and bills and all this stuff. And over time, it's always this constant struggle day over day, and maybe over a window of time, over 4, 5, 6, 10 years, now all of a sudden I'm in that right-hand side. We see people that don't get into substance misuse until years, then you're like, what happened there? Well, I want people to understand, people just didn't wake up today and decide to go do something. This has been something that's been manifesting in them for a while because it's a coping mechanism, and substance use is a coping mechanism, and I'm not going to touch on a lot of that because we could spend a whole day here if we really dove into that as well too, but just understand that I just think I probably would have been 0 to 100 in my situation 8 years ago if that person didn't reach out to me. I really believe that I probably would have been over on that side of the wheel of this graph pretty quickly. Got another question right there. Look at that, we can toss it around. It's not gonna.
So when you mentioned earlier that it's death by suicide.
Yep.
That was very intriguing and not how it's normally perceived.
Correct.
I think this chart is very interesting because it more is a visual aid to represent that.
Mm-hmm.
So I guess my question really is, when did you start to think of that differently? Is this chart kind of part of it, or how can we help change the perception of that?
I would say that, and I don't know how many people, so Brandon was here last year, so he's one of kind of the industry leaders in this. I don't know how many people have heard the name Cal Byer, but Cal is a colleague of mine. been in this business a long time. I hired Cal. He worked for me. Him and I are the ones that started this Hard Hat Health within the Holmes Murphy construction world. I just think we were just talking to a lot of people since about 2015, 2017, trying to put something around this. And really, we just kind of made this graph kind of where we thought things were, based on my history in construction and other construction workers trying to figure out what they start seeing of construction workers related to missing work and related to different things. Is it in a book anywhere? No. This is kind of my little group of people that have been focusing on this for about 8 to 10 years now, just trying to figure out where we thought this life cycle looks like, and just spent, I probably have asked 10,000 of these questions over since 2017 in the same group you're doing. So we have a pretty good database of how people are answering these things. So that's kind of where this came from. Real life polling questions, trying to get through it and stuff like that. Did that answer your question? Or not?
Sort of.
Okay.
Yeah.
I don't want to be sort of answering questions. I was
just trying to say, how do we help change the perception?
Here's the deal. So again, and we're going to talk about this again, it is taking that 11-year window and shortening it up. Okay. That's really the straightforward answer is, I don't want 11 years to go by from a construction worker that is struggling with something so they get over there. Our goal should be keeping everyone on that left side of that chart. Because that's where we make an impact. We don't get to tardiness and not showing up for work and calling off and being in the presenteeism and all that stuff, and then pretty soon the use of medications, of alcohol, and all the legalized marijuana now that's out there. I mean, it's a pretty easy thing to get to a substance to start misusing it legally. And I'll have a few more things that tie into that slide as we go. The good news behind all this is that the individuals that have resources and get help and know what to do, we have a 70-90% success rate of people, and I don't want to use the word get better because I don't like that word either, that have an understanding of what is impacting them. Whether it's financial, right? How do I get better help financially to figure out my life and financial planning? What's my resources? We're going to talk about EAPs in here in a second. They all suck. They do. EAPs are horrible. And we're going to talk about that at the very end. Everyone's like, no, they're not. They're great. I'm like, okay. I'll argue with you all day long on that. But the ones that have an opportunity to get resources and find out where to go, who to talk to, what to do, we have a 70-90% success rate of those individuals starting to have a positive impact in understanding the stressors that they're dealing with. Like the hardest thing for parents, my daughter's 35 now, my son was 30 when he died. The hardest thing for me was when they were teenagers. I had no clue how to handle anything. Well, think about parents having that stress in their life. That is a huge stressor in a parent's life. Well, how do you get help for that? There's a lot of parents that don't have a clue what to go do or how to figure it out, or there's support groups, and there's moms and there's dads that have support groups and things in their communities. There's NAMI, there's AFSP, there's all kinds of things. But how do we get that information to people so they can start using it to understand that you're not alone? But there's a lot of parents that will sit there and yes?
I have not yet been in the industry very long, just because I'm finishing my degree now as a student. But earlier in the presentation, you mentioned that the rate in the age group in late teens to early 20s is like drastically increasing.
Yep.
With being and representing that crowd, I 100% agree. And my question is, do you think media has to play into any of that? Because
do I think media?
Yes. And
do I think social media? Yes. So if we actually cut one thing out in everyone's life, which is the throw the cell phone and social media away, you would see a drastic change in mental health and suicide rates in the U.S. across all demographics, but more importantly, middle teens to early 20s.
I would agree. I think the biggest thing for me, because I'm a very anxious type, as I'm sure a lot of people in this room are just high strung. That's how the construction industry is.
Yep.
As a 20-year-old, like I get on TikTok or whatever, just to try to downtime, and then it's like, you should be starting a Roth IRA. And I'm like,
but here's what I want you to think.
What is that? It's like,
think about what you just said. It's a high-stress, high-strung environment in what we do every day. Going home and getting on social media doesn't take that stress level down. So when is your downtime on stress level? 0. Right?
Yeah.
When is there a break from this whole stressor on somebody's life? And social media is trying to convince you to be somebody you're not. I hate to say it. It doesn't matter what political realm you're from or what you believe in or what you do. Everybody is trying to convince you to be somebody you're not, or trying to convince you that them people over there are bad and we're the best. It doesn't matter. Name me one positive social media story that somebody read here in the last 24 hours. How many people have read a negative social media thing in the last 24 hours? Everybody raises their hand. So that's you don't get any relief from it on social media, I'm sorry. And then there's also these studies that talk about if you're on it at night just before bed, your brain never shuts off. Pretty soon you're tired, you get this whole fatigue thing. That is a huge play into mental health, mental well-being. You're tired all the time, and you can, pretty soon sleep deprivation. So, yeah. You're spot on.
Yeah, well, and I've just noticed, as a young person, you see all these different advices from people that are older that are trying to steer you in the right path, which is great, but sometimes being so young, again, I'm jokingly bringing up a Roth IRA, I'm 20, I should not be worrying about that.
Right.
But it's one of those things, you see it so much, and you're like, I want to be ahead, I want to do that, but before you know it, you're drowning in an ocean because you're not doing everything that everybody's wanting you to do.
Yeah. Sometimes the advice can be overwhelming, and that's why I just tell it's always a cautious factor in some of this of how we point people and what we do with stuff, but I think having the ability to identify resources for yourself and do some research and have that ability, I think is better than 40 people screaming in your ear how to do something. Because again, everyone's trying to tell you how they're better at doing something, so you should listen to me versus that, and I'm just like, really? You're an adult. Make your own decision, but here's the resources that we have for you to go talk to. Which maybe is a financial planner. I'm not going to tell you how to financially plan. I can tell you how I would do it, but I don't believe you should do how I've done it. It doesn't make sense. So let's talk a little bit about the human case about this. So again, we know from statistics, and again, some of these statistics bounce back and forth, but 60% of our workers this year, I will tell you right now, that number's low, but are going to have a stressor impact them this year. It's going to happen. 75% of those workers don't have access to resources. How can we win or make a difference? When 3/4 of the 60% are going to just sit there and go home and go, now what do I do? Oh, I better go crack a beer. I better go crack another beer. Oh, some Jack Daniels. Oh, another beer. Trust me, I did that. I drank gallons of Jack Daniels during my morning. Gallons. I should have had shares in the Jack Daniels business. But that's how you do it. I didn't know it. I didn't get it. 50% of our workers, less than 50% of your workers feel that your company prioritizes this. And that's still a challenge out there when I do this. Is that workers still don't think their company gives a crap. Here's a question I ask construction companies. What's your most important asset in your company? What do you think every construction company says? Your people. Really? They don't think so. They don't think so. It's a bunch of words if you say your people. But if you have nothing behind it, it's just a bunch of useless and a bunch of empty words. Period. only about 40% of your workers in the people out in the field feel their supervisors have adequate capabilities to deal with this. Think about that. 40% of our workers feel that their supervisor or manager is equipped to support their mental health needs. Well, do you think they're going to go talk to their supervisor if they think their supervisor has no clue? No. We got to change that. And we'll talk about that here in a minute. But I wanted to throw this up there because this is what we're dealing with and what the workers in the field think about. Oh. That's not what that says. That's what I'm... Okay, I'll go through this a little bit quicker. Sorry. I get passionate about this topic. All right, let's just talk about a business case. For anything else, I throw this slide in there when I try talking to executives. If you don't believe me, let's talk about a business case. We have a worker shortage in the construction world. It's about 500,000 workers. By 25, 26, we're looking at 750,000, maybe approaching 1 million construction worker shortage coming up. Well, take a look at these statistics. 35% of the workers have left construction because of mental health reasons. 25% of your current workforce is contemplating it. How do you catch up to the numbers of the shortage if we got people leaving or people contemplating leaving? Lost productivity on a given year is about 27 days per individual who has an impact from a mental well-being, mental health related issue or challenge. And again, the good news is for those that seek help and get help and have resources, we have an 86% increase in their productivity in what they produce and how they have an input on the backside. There's a business case here. I don't like doing that, but sometimes that's how I got to get through executives. Like when they don't believe me, I'm like, here it is. This is the truthful statistics out there. I'm going to go through this a little bit quicker here because I want to get to the stigma piece. Okay, what generation are you guys from? Answer this question really quick because this is an important slide coming up. I'm assuming I'm going to have a lot of, maybe I'm going to have some Z's. Look at that. Z's are dominating me in here. As typical, my boomers like me, we're getting extinct. We have no traditionalists. This is pretty much right. Boomers are pretty low in the construction industry. We're seeing less and less. I'm in the tail end, 64 for me. So I'm in the tail end of that. You know, our X's, I'm surprised I don't have more X's, but I'm dominated by millennials and Z's in here. Why is that important? 50% of millennials have left or are leaving construction because of mental health reasons. Think about that. And my Gen Zs, you're even more vulnerable to leaving the construction industry because of mental health reasons, right? I grew up in the world of working 80 hours a week and sacrificed weekends, sacrificed ball games, sacrificed everything that my kids did because I thought that's what I needed to do to work. I would probably tell you that if I start looking at millennials and Zs, it's more of a work-life balance than it is working 80 hours a week and working weekends and never being home. Construction, we work on the road, right? Think about some of these numbers. How do you battle what we're going to be dealing with in the next 2 or 3 years, which is a work shortage, plus people leaving this industry because of the type of lifestyle and the type of things it is? It's hard. All right, so let's understand some of this. When you think of yourself in here, here's some questions. You might not even know you're experiencing some mental health issues unless you really understand and recognize what's impacted you. Mood changes, change in sleep behaviors. All of a sudden, maybe it's drinking a little bit more. Maybe it's doing certain things, right? Understand, think about what is impacting you and why it's happening. Others may recognize the struggles, but you may deny it. Self-awareness, learn about mental health, get educated about it, understand the stressors, understand that, again, I don't need to be in a straitjacket. I'm not in an asylum. I maybe not, I'm not seeing a psychiatrist, but I might have something that's impacted me. Understand what that is so you can help figure out the struggles and the challenges you may be going through. Again, sleep patterns, lack of motivation, isolating yourself, inability to concentrate, lack of self-worth. There's a lot of different things to be thinking about when it comes to yourself. Okay, here I just want to get through some of these questions. Has mental health, substance use, or suicide impacted your life? And so, again, I think this is pick all of those or none of those or whatever you would like to do. They're pretty heavy questions to answer. And again, I'm not going to specifically call out these numbers, but I want you to look at these numbers. We've had a good percentage in here that haven't had an addiction or suicide or have had some mental health challenges, but we've had a percentage in here that have. So again, when you look around the room, you're not the only one. All right, so probably for most of us, particularly in the construction world or at home with your family, this is an observable thing. Because I'm going to come back to this slide. We all have a baseline on our friends and our family and our workers. And what I mean by a baseline, we kind of know their behaviors, their patterns, their attitudes, things that they do, because we've been around them long enough, whether it's a coworker, whether it's a friend, it's a sibling, it's a mother, it's a father, it's one of your close friends. I can tell you all my close friends and all the things they do and how they act and all, and it's like clockwork. So what does this mean? That if somebody starts changing what happens or what they are and who they are, it's not because one day I woke up and said, I'm going to become a crappy employee. Let's say for 5 straight years I've been a stellar employee. Come to work all the time, early, leave late, do whatever it takes. I'm a team player. I'm engaged in everything. All of a sudden I start coming in tardy. I'm 15 minutes late. I'm 20 minutes late. In construction, how do we handle that right now? No, untrue. We use threats. Hey, you understand you got to be here at 7 a.m. I can't be having this anymore. If you can't show up on time, I don't know if you can be working here anymore. Really? We didn't go, well, for 5 years, stellar employee, all of a sudden they started having this change. Maybe the approach is, hey, let's go talk. Because I've recognized a change in who you are and what I've been recognizing from 5 years to now. What's going on? Are you okay? Just think about somebody that's in a struggle right now with a stressor and a mental health issue that they're dealing with, and you just went and threatened them with their job. Where did that put somebody? Over the top? Right? It's a different approach. Now, I'm not saying there's not crappy workers out there, but I am going to tell you that every time I've had this conversation, I have had executives, project managers, superintendents come up to me going, I got to go call this guy right now. Because you're exactly right. This guy was a model citizen for 7 years, and all of a sudden this started happening. I threatened him, and he didn't change, and I fired him. And I'm like, so you just fired one of your best employees before you understood what was really going on. You just used threats. So this baseline thing here, whether it's a worker or a family member or a friend, is a really good thing to understand and be able to approach somebody and ask them how they're doing, and then be able to tell them maybe some observable things that you've seen, the change in their behavior, their attitude, how they deal with. Maybe you have a friend that's always been a social butterfly, that's always been in the group, and all of a sudden you recognize they're not coming around anymore. Don't like jettison them aside thinking that they don't want to be your friend anymore. Maybe there's something going on that you should go ask the question, are you okay? And then why are you isolated or not part of our group anymore? Okay? So again, it's signs and it's symptoms, right? The signs I see are the things I observe. The symptoms are what that individual might be going through, right? So again, you can, when you start understanding recognizable baselines and signs of people that you've been around a lot, coworkers and things like that, you can start maybe having an understanding that they're having an impact with something. I think we're so used to just jettisoning people out of the way because of the thing. What's under the hard hat, again, is one of our things that we as one of our practices. The PPE world in construction focuses on the outside, the high vis, the hard hat, the boots, the gloves. I wanted to focus in on what's under that, the brain, because I think it's a huge component for how we do stuff. Really quick, how can mental health stressors and other challenges impact a worker's work performance and daily engagement on the job site? So again, it's a word fill. Just type in words. I'm running really low on time. I've went over my time already, but I haven't lost anyone yet, so that's good. So again, disengaged, slow down, unmotivated, lack of motivation, poor performance, accidents, mistakes, low productivity, negative, yep. All the things that I would see from the group. So the word presenteeism, remember I said it is an actual word and we talk about it. So what is presenteeism? It's when a worker's at the job site or at work, but they're not really there because they're physically engaged, but mentally they're not engaged. Because whatever's impacted them from a stressor or a mental health or mental well-being struggle is the singular most important focus on their brain, but they're actually at work. So think about this as an iron worker. Our rate of suicide from an iron worker standpoint. Think about this as an iron worker that's 50, 60, 70, 100 feet up in the air. When everything they do has to be precise. Everything has to be calculated and everything has to be planned out. They have this going on, and one split second, that mental engagement is gone because they have a stressor they're thinking about. This is the reason why I really focused on this starting in 2017, because I believe a lot of our bad accidents in construction come from this. From the word presenteeism. It's a real word. Means you're there, but you're not really there. So again, what happens? Near hits, serious injuries, quality control defects. I got supervisors not paying attention, not following what they're supposed to be doing, not double checking, not doing things because they're not engaged. We see a lot of quality control. I believe that's a lot of it. Labor costs, low productivity, schedule delays, sequence changes. I'm telling you, mental health plays on every part of the construction world out there, not just safety, but all the production side of it too. And the last couple pieces, I won't talk a lot about it, but substance use, just understand the numbers are getting off of the chart. We're starting to see overdoses in the U.S. We topped 100,000 2 years ago. It was 108 last year. I think we're going to be on record pace to be around 125,000, maybe more this year from a death by overdose standpoint. A lot of people self-medicating. That's how they cope with stressors. It's just the way it goes. %22 of our suicides involve some type of alcohol misuse. And in construction, it's a big thing. Knox alone, a number of different Narcans. You're seeing a lot of companies start to implement programs to put these on job sites, which I never thought we would be there ever. but with what we're seeing from overdoses, I'm getting calls every week from my clients about overdoses on construction sites, which I never did 5 years ago. It's one of my most taken phone calls about what do we do. I'm like, so again, huge. So begin the journey, begin the conversation. Normalize this. Normalize mental health and mental well-being the same way that you would physical health. Losing weight, working out, exercising. Mental health has to be in that same category. We have to normalize it. We have to get our mental health healthy to be 100% functioning and engaged in work and in life. And then again, leadership's important. This is a top-down thing. This isn't a bottom-up thing. This is leaders really making this a cultural thing and how they do it. Okay. The last piece on this one is for, do I have any safety people in here? I don't think so. Oh, I got one person. He doesn't even want to raise his hand. The reason I say that is a lot of companies want to make this the responsibility of the safety professional and the safety organization within a company. I would tell you that's the wrong thing to do because it just becomes another safety program. This has to be from the president, the executive, the CEOs, the COOs pushing this thing downward and leading the charge, leading the effort, having the conversation. If you just tell your safety person to go develop me a program, it's going to be nothing more than a PPE program, and it's not going to be successful, and no one's going to believe you even care. Because the only people talking about it are your safety people and not the executives. EAPs, they don't work, they suck, just so you know. Most EAPs provide little value to workers. The national utilization rate for EAPs is around 3%. 3%. Think about how many millions of construction workers there are, and the utilization rate is less than 3%. They have limited care options, not focused on mental health, not focused on critical response, poor care quality if you're able to get into a network, hard to access. What we want to do is start looking at some of these newer ones that are having a big focus. There are a few new upstarts that are really focused in on mental health, critical response. They're easy to use. They have a lot of stuff. But what I will tell you, the first place to start with EAPs is just test your system. Call in. Ask what resources there are. Call in and say, I have a mental health issue. I need to talk to somebody right now and see how they respond. Because they're probably going to say, what's your phone number? I'll have someone call you back. So if you're one of the few that have really focused on your EAPs and have made them strong, thank you. For the ones that just know what the word EAP means, it's probably not a very good thing. I've had clients going through this, and it's pretty eye-opening to people when you start looking at these things. Yeah. And again, 988, if you want to know a couple things on here, 988 is the new crisis hotline for suicide prevention, for mental health. So if somebody is struggling and you need to have immediate access because you don't really know what resources are out there, 988 has been working excellent across the country. You call in there, you get a live individual that's a crisis response individual that's actually been in the therapy world and the psychiatrist world, and that's who they're talking to. So it's been really good. I've had a lot of people have positive responses. The veterans one is 988, then one they have different people that respond to the veterans of this world. But there are other things, mental health first aid, QPR, Living Works training. I will tell you locally, AFSP, American Foundation for Suicide Prevention, just go to there. Tons of great resources, boots on the ground, bottom up, NAMI, National Alliance for Mental Illness. All the places that you're from and your local communities and around there will all have specific chapters for AFSP and NAMI. It's a really good place to get engaged, look at what resources they have. Project Healthy Minds is focused on disease and millennials. They have a really good thing for the younger generations. And the CISP, which is the top one up there, that is specifically baked around and built around the construction industry and lots of resources for the construction world out there. Sorry I went over. I didn't know I only had I was just going by the clock down here. That's all I was doing. All right, any questions? Everyone's like, it's Friday afternoon. I want to get out of here. We got a question way back there.
Hi. I just have a curious question. When you're talking about these stressors, are we considering the ones at the personal level or workplace or both? Because at the personal level, like, we don't have much control over that.
I think it's both, because I can have stressors from anything, right? Mm-hmm. I mean, I can have a stressor from something that happened at this event.
Yeah, okay.
That I take home with me. I would say that a lot of the stressors come from, well, there's still a couple in construction. We still have a bullying issue in construction, or at least people perceive to be bullying, because I still have supervisors that scream and holler, and I still have people that still do those type of things. I would say that a bigger percentage of the stressors come from home into the work environment.
Uh-huh.
So, but again, I could be a worker on the road working, mm-hmm. and I could have a double impact. A, I'm working on the road, so what's the only thing I have? I have a hotel room and I have a bar. Right? Mm-hmm. But then everything, because I'm not home, maybe my spouse is getting a little upset with me because I'm not there for the kids. I'm not able to take them to their games. I'm not taking them to the doctor. I'm not for the dance recital, for all the parent-teacher conferencing. So pretty soon now, all of a sudden, I have this thing going on at home and this thing going on at work, and both of them are colliding. So it can be those stressors can come from anywhere.
Okay.
You know, that's the thing about these stressors, that, you know, you don't know where they're going to come from. I think it's just to recognize that self kind of assessment in your brain. Am I changing? Mm-hmm. And if you're changing, how do you understand what's making you change?
Okay, thank you for
Yep.
that.
Any other questions?
I will invite to ask questions. If you want to stay in the room, I don't want to decide, you know, that we want to wrap up the session.
Yep.
Please stay here in the room. And for those who were planning to go to the evening program, let's say thank you to Scott. Scott, please don't leave the stage.